Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. To use pulse oximetry, first check with the charge nurse to determine what type of sensor to use.
Okay, Ms. Mays, let me just look here and see if I can find a good site that I can put my sensor. Your nails look
Then
so
select
pretty
a site
today.
for sensor placement, such as the patient's earlobe, the bridge of her nose, a toe, or a finger.
Looks like you have good circulation here. That makes a good spot to put the
However,
sensor.
avoid a finger on the same side as an electronic blood pressure cuff. Also, avoid any site that has nail polish, artificial nails, swelling, or open skin. If the selected site is a finger or toe, remove any nail polish or artificial nail with acetone or polish remover. Ensure that the site is free of moisture. When a patient has special needs, the charge nurse may tell you to use an ear for a patient with tremors, an ear or bridge of the nose for a patient with peripheral vascular disease, a tape-on sensor for a patient who is too obese or active for a clip-on sensor, or a clip-on sensor instead of a disposable adhesive one for a patient with a latex allergy.
Okay, Mrs. Mays, I'm going to really need you to be still for me for just a moment.
Position the patient comfortably.
Very comfortable.
If you're measuring pulse oximetry on her finger, support the lower arm and instruct her to keep that finger still. Clip or tape the probe to the site, ensuring that the sensors line up across from each other. Turn on the oximeter. Take the patient's radial pulse and compare it to the oximeter pulse rate. If they don't match, compare the apical pulse with the oximeter pulse rate. Leave the sensor in place until the oximeter reading is constant. Then read the oxygen concentration, or SpO2, on the digital display. For continuous monitoring, set the high and low alarm limits for the SpO2 and pulse rate as directed by the charge nurse. Make sure that the alarms are on.
Mrs. Mays, everything looks
Observe her
good here.
skin for open areas or irritation under the sensor at least every 2 hours. Relocate the sensor at least every 4 hours.
It does look good, but the doctor wants...
After intermittent monitoring, or when discontinuing continuous monitoring, turn off the power to the oximeter. Then remove, clean, and store the sensor.
Remove the sensor. And I'll be back to check on you in just a bit.
Okay.
As part of your follow-up care, document the patient's SpO2 and notify the charge nurse if the alarm sounds for any reason, or if the oxygen concentration falls below the limit indicated by the charge nurse. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.